If you're experiencing symptoms such as itching, burning, and discharge down there, you're not alone. In fact, over 75% of women will experience a yeast infection at least once in their lifetime. But don't worry, we're here to provide you with all the answers to your frequently asked questions about yeast infection. What are yeast infections? These are a type of fungal infection caused by excessive growth of yeast, usually Candida albicans, in the body. They can occur in various parts of the body including the mouth, throat, skin, and genitals. In addition to vaginal yeast infections, other common types of yeast infections include oral thrush. This is a yeast infection of the mouth and throat, characterized by white or yellow patches on the tongue and inner cheeks, as well as soreness and difficulty swallowing. Skin yeast infections. This can occur in areas such as the armpits, groin, and under the breasts, leading to redness, itching, and irritation. Nail yeast infections. This is characterized by thick, discolored, and brittle nails that may separate from the nail bed. Factors that can contribute to the development of yeast infections may include antibiotic use. The prolonged use of antibiotics can kill off both harmful and beneficial bacteria, disrupting the balance of microorganisms in the body and allowing yeast to overgrow. Hormonal changes. Fluctuations in hormones during pregnancy, menopause, or the menstrual cycle can create an environment conducive to yeast overgrowth. Diabetes. High blood sugar levels can promote yeast growth. Weakened immune system. Certain medical conditions, such as HIV, AIDS, or cancer, and medications that suppress the immune system can increase the risk of yeast infections. What is vaginal yeast infection? This is a fungal infection that causes irritation, discharge, and intense itchiness of the vagina and the vulva. It is also called vaginal candidiasis. Vaginal yeast infection affects up to 3 out of 4 women at some point in their lifetimes. Many women experience at least 2 episodes. The fungus Candida albicans is responsible for most vaginal yeast infections. Your vagina naturally contains a balanced mix of yeast, including Candida, and bacteria. Certain bacteria like lactobacillus act to prevent an overgrowth of yeast, but that balance can be disrupted. An overgrowth of Candida or penetration of the fungus into deeper vaginal cell layers causes the signs and symptoms of a yeast infection. What is yeast infection in men? Yeast infections in men, also known as balanitis, are caused by the overgrowth of the Candida fungus. Symptoms may include itching, redness, and irritation in the genital area, as well as pain or burning during urination or sex. Men who are uncircumcised, have a weakened immune system, or have diabetes may be more susceptible to developing a yeast infection. Treatment typically involves antifungal medication applied topically or taken orally. Prevention measures include practicing good hygiene and avoiding prolonged exposure to moist or warm environments. What are yeast infection symptoms? Your presentation can range from mild to moderate and include itching and irritation in the vagina and vulva, a burning sensation especially during intercourse or while urinating, redness and swelling of the vulva, vaginal pain and soreness, vaginal rash, thick white odor-free vaginal discharge with a cottage cheese appearance, and watery vaginal discharge. If you have severe signs and symptoms such as extensive redness, swelling, and itching that leads to tears, cracks, or sores, or if you have 4 or more yeast infections in a year, you might have a complicated yeast infection. In this case, it is recommended that you see a doctor as soon as possible. What is yeast infection discharge? This is a common symptom of a vaginal yeast infection. It is usually thick, white, and clumpy, and may have a cottage cheese-like consistency. In some cases, the discharge may be watery or thin and may have a white or gray color. The discharge is caused by the overgrowth of yeast in the vagina, which can lead to an imbalance of bacteria and yeast. It's important to note that not all vaginal discharge is a sign of a yeast infection. Normal vaginal discharge is usually clear or white and may be thin or slightly thick. It may also change in texture and volume throughout the menstrual cycle. What are yeast infection sores? A sore may occur when a rash forms as a result of the infection or by the use of alternative methods of treatment. However, yeast infections typically do not cause sores at all. A yeast infection can lead to small cuts or tears in the vulva or vaginal area, which can be painful and may be mistaken for sores. However, these are not true sores and can be treated with topical creams or ointments. If you are experiencing sores in the genital area, it could be a sign of a different condition such as herpes or genital warts. It's important to see a healthcare provider for proper diagnosis and treatment. They may perform tests to determine the cause of the sores and recommend the appropriate treatment. How is a yeast infection diagnosed? If you have symptoms of a vaginal yeast infection, you'll need to see your healthcare provider to get an exam and an accurate diagnosis. Commonly, a high vaginal swab is taken for microscopy and culture. Self-diagnosis, based on your symptoms and a history of previous yeast infections, is wrong more than half the time. Are yeast infections sexually transmitted? A vaginal yeast infection isn't considered a sexually transmitted infection. But there's an increased risk of vaginal yeast infection at the time of first regular sexual activity. There's also some evidence that infections may be linked to mouth-to-genital contact, oral genital sex. What is a complicated yeast infection? You might have a complicated yeast infection if you have severe signs and symptoms such as extensive redness, swelling, and itching that leads to tears, cracks, or sores. Other presentations may include having 4 or more yeast infections in a year, if you have a less typical type of fungus that causes your infection, pregnancy, uncontrolled diabetes, weakened immune system because of certain medications like prolonged use of antibiotics, or conditions such as HIV infection. How can I prevent getting a yeast infection? Some tips to help prevent vaginal yeast infections include wearing cotton underwear and loose-fitting pants or skirts, avoiding tight-fitting underwear or pantyhose, immediately changing out of wet clothes such as swimsuits or workout attire, staying out of hot tubs or very hot baths, wiping from front to back after using the toilet, using unscented pads or tampons. When should I see a doctor for a yeast infection? Make an appointment with your doctor if this is the first time you've had yeast infection symptoms, if you're not sure whether you have a yeast infection, if you start having other symptoms, or if your symptoms aren't relieved after treating with over-the-counter antifungal vaginal creams or suppositories. What are yeast infection treatments? Treatment for yeast infections typically involves antifungal medications, which can be administered orally like diflucan, applied topically like vaginal clotrimazole, or inserted vaginally like miconazole. If your vulva is itchy, you can apply an anti-itch fungal cream such as vaginal clotrimazole. The anti-itch cream should be used in combination with antifungal medications as the anti-itch cream won't cure a yeast infection alone. A single-dose oral drug such as fluconazole is one of the fastest ways to clear up a yeast infection. It can be taken in one day, but it may take a few days for symptoms to improve. Single-dose treatments can be obtained over the counter or with a prescription. If your symptoms are severe or you have frequent yeast infections, your doctor might recommend long-course vaginal therapy or multi-dose oral medication. Your doctor might also recommend boric acid, a suppository inserted into your vagina if the Candida fungus is resistant to the usual antifungal agents. It's important to follow the treatment regimen as directed by a healthcare provider to ensure effective and complete eradication of the infection. In some cases, lifestyle changes such as avoiding tight-fitting clothing, using a mild soap, and avoiding douching may also be recommended to prevent recurrent yeast infections. Home remedies that may help relieve vaginal yeast infections may include the use of garlic, vinegar, boric acid, tea tree oil, and others. However, it's important to use them correctly and see a doctor if the symptoms don't resolve. It's best to consult a healthcare provider and get rid of a yeast infection early with an OTC or prescription treatment. How can I get rid of yeast infection in 24 hours? Getting rid of a yeast infection in 24 to 48 hours is not possible. Over-the-counter and prescription antifungal medications can take several days to a week to work. To alleviate symptoms and speed up healing, consider using antifungal creams, taking probiotics, eating a balanced diet, and making lifestyle changes such as wearing cotton underwear and avoiding scented products in the genital area. If symptoms persist or recur frequently, see a healthcare provider for proper diagnosis and treatment. Thank you for watching this episode of Frequently Asked Questions about Vagina Yeast Infection. Please watch out for the other episodes of this series. I hope you found this information helpful and informative. If you have any questions or topics you'd like me to cover in future videos, be sure to leave a comment below. Don't forget to like, share and subscribe to stay up to date with all of our latest content. Remember, knowledge is power.